VEOPOZ is a complement inhibitor indicated for the treatment of adult and pediatric patients 1 year of age and older with CD55-deficient protein losing enteropathy, PLE, also known as CHAPLE disease. Injection, 400 mg/2 ml, 200 mg/ml, as a clear to slightly opalescent, colorless to pale yellow. Solution in a single-dose vial. Dosage forms and strengths. Injection, 400 mg/2 ml, 200 mg/ml, as a clear to slightly opalescent, colorless to pale yellow. Solution in a single-dose vial. Warnings and precautions. Serious meningococcal infections. Life-threatening and fatal meningococcal infections have occurred in both vaccinated and unvaccinated patients treated with complement inhibitors. The use of VEOPOZ increases a patient's susceptibility to serious and life-threatening meningococcal infections, septicemia, and/or meningitis, caused by any serogroup, including non-groupable strains. Complete or update meningococcal vaccination, for serogroups A, C, W, and Y, MENASUI and serogroup B, MEN, at least 2 weeks prior to administering the first dose of VEOPOZ. According to the most current Advisory Committee on Immunization Practices, ACIP recommendations for patients receiving a complement inhibitor. Revaccinate patients in accordance with ACIP recommendations considering the duration of VEOPOZ therapy. Other bacterial infections. VEOPOZ blocks terminal complement activation, therefore, patients may have increased susceptibility to encapsulated bacterial infections, especially infections caused by Neisseria, meningitis but also Streptococcus pneumoniae, Haemophilus influenza, and to a lesser extent, Neisseria gonorrhea. Patients treated with VEOPOZ may be at increased risk of developing serious infections due to Streptococcus pneumoniae and Haemophilus influenza type B, HIB. Administer vaccinations for the prevention of Streptococcus pneumoniae and Haemophilus influenza type B, HIB, infections according to ACIP guidelines. Patients receiving VEOPOZ are at increased risk for infections due to these organisms, even if they develop antibodies following vaccination. Interrupt treatment with VEOPOZ in patients who are undergoing treatment for a serious encapsulated bacterial infection until the infection is resolved. Counsel patients about gonorrhea prevention and advise regular testing for patients at risk. Systemic hypersensitivity reactions. Hypersensitivity reactions, including anaphylaxis, have been reported with administration of complement inhibitors. Interrupt VEOPOZ and institute appropriate supportive measures if signs of cardiovascular instability or respiratory compromise occur. Immune complex formation. Immune complex formation has been reported during the transition of therapy between complement inhibitors, resulting in transient decrease in drug concentrations as well as symptoms suggestive of hypersensitivity reactions. However, this has not been studied in patients with CD55 deficient PLE switching from other complement inhibitors to pozelimab. The potential for immune complex formation should be considered if switching complement inhibitors. Adverse reactions. Serious meningococcal infection. Other bacterial infections. Systemic hypersensitivity reactions. Immune complex formation. Drug interactions. Intravenous immunoglobulin. VEOPOZ has not been studied in combination with intravenous immunoglobulin. Intravenous Immunoglobulin may interfere with the endosomal neonatal Fc receptor, FcRn, recycling. Mechanism of monoclonal antibodies such as pozelimab thereby decrease serum pozelimab. Concentrations. Avoid concomitant use of intravenous immunoglobulin with VEOPOZ. If concomitant use cannot be avoided, monitor patients for worsening of clinical signs and symptoms of CD55-deficient PLE. Description: Pozelimab BBFG, a complement inhibitor, is a recombinant monoclonal antibody, IG4 isotype. Pozelimab BBFG is produced by recombinant DNA technology in Chinese hamster ovary, CHO cell suspension culture and has an approximate molecular weight of 145 kDa. VEOPOZ, pozelimab BBFG, injection is a sterile, preservative-free, clear to slightly opalescent, colorless to pale yellow solution supplied in a single-dose glass vial. Free from visible particulates, for intravenous or subcutaneous use. Each vial contains 400 mg pozelimab BBFG in 2 ml of solution with a pH of 5.8. Each ml contains 200 mg pozelimab BBFG, arginine, hydrochloride, 21 mg, histidine, 1.15 mg. L-histidine hydrochloride monohydrate, 2.65 mg, polysorbate 80, 1.5 mg, sucrose, 20 mg, and water for injection, USB. Mechanism of action. Pozelimab BBFG is a human, monoclonal immunoglobulin G4P, IG4P, antibody directed against the terminal complement protein C5 that inhibits terminal complement activation by blocking cleavage of C5 into C5a, anaphylatoxin, and C5b, thereby blocking the formation of the membrane attack complex, C5bC9, a structure-mediating cell lysis. Clinical studies. The efficacy and safety of VEOPOZ were evaluated in a single-arm study, NCT 04209634, where outcomes were compared to pretreatment data in patients with active CD55 deficient protein-losing enteropathy, PLE, who had hypoalbuminemia. Diagnosis was based on a clinical history of PLE with a confirmed genotype of biallelic CD55 loss-of-function mutation. Active CD55 deficient PLE was defined as hypoalbuminemia, serum albumin concentration of less than or equal to 3.2 grams/dl, with one or more of the following signs or symptoms within the last 6 months: abdominal pain, diarrhea, peripheral edema, or facial edema. Patients received a single 30 mg/kg loading dose of VEOPOZ administered by intravenous infusion over approximately 1 hour, followed by a once-weekly weight-tiered maintenance. Dosage, administered as a subcutaneous injection starting 1 week after the loading dose. All patients received meningococcal vaccination prior to treatment with VEOPOZ and antibacterials for prophylaxis of meningococcal infection. Patients were permitted to receive additional therapies as part of standard of care. Use of other complement inhibitors was prohibited. 10 patients ranging from 3 to 19 years of age, median of 8.5 years, were assessed for efficacy. 6 patients identified as female, 7 patients as white, 2 patients as Asian, and 1 patient reported race as other. The mean baseline serum albumin concentration was 2.2 grams/dl with a Range of 1.1 to 2.9 grams/dl. House applied/storage and handling. VEOPOZ, pozelimab BBFG, injection is a clear to slightly opalescent, colorless to pale yellow solution. It is supplied in a carton containing one single-dose glass vial of 400 mg/2 ml, 200 mg/ml, NDC 61755-01401. Store VEOPOZ vial refrigerated at 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit, in the original carton to protect from light,